Hello everyone. In this mentorship session, I will be telling about what are the things you have to keep in your mind while reading obstetrics and gynecology. See, obstetrics and gynecology is unfortunately one of the most ignored subject, okay, in final year, especially boys and of course even girls too are started ignoring obstetrics and gynecology these years. But in this session, I will tell you why reading OBGY is very important in the upcoming months, okay, before your university examination. How to prepare, how to read smartly, how to do well in your practical, everything. So yeah, as I told you, OBGY is a subject which is ignored by many students, but okay, I am putting a caution, never do that. You have two papers. One is obstetrics, paper 1, 100 marks. Paper 2, gynecology, 100 marks. Practical, which is the most deciding one. Many students, they just have a score of just 100 out of 200. That is the so-called just pass when it comes to practical, because to the contrary, OG practical is very tough and it is conducted very seriously, and so it completely depends upon how far you have prepared in your obstetrics and gynecology. Okay, so you have to really prepare well to do really well in your OBGY practical. So that is for 200 marks, so total 400 marks. So see how far medicine and surgery is important, OBGY too is important. Okay, then coming into the what are the sources you can use for OBGY, and the most common question I am getting from every student is, sir, marrow, is it enough to read obs and gynae? My humble answer, yes, it is more than enough. If you read marrow along with the practical textbook called Hepzibah, you can very well, you can really do well both in your theory as well as practical examination. Of course, you have to see the side by side the university question papers and the question bank, so that you don't miss even a single question which is asked in your university exams, because in marrow they have discussed every topic, and in that you have to selectively read for the university exam. And coming into textbooks, if you are a student who follow textbook, of course, Mudaliar and Menon is a textbook that you must read, especially if you are doing MBBS under Tamil Nadu Dr. MGR Medical University. All the examiners, all the departments in Tamil Nadu, they strongly emphasize you that you must read Mudaliar and Menon. Datta is not preferred for obstetrics, but at the same time, Datta you can do for gynecology, because Shaw is a very standard textbook. It takes a lot of time. So Lakshmi Sheshadri or Datta is good for gynecology, but Datta don't follow for obstetrics. And in the last years, okay, in the so-called last 4 to 5 years, while seeing the university question papers, what I came to know that the number of questions from the basic topics, okay, has been very high in both obstetrics as well as gynecology. What even be the basic topics? The gametogenesis, the physiology of reproduction, the capacitation, anatomy of female genital tract, anatomy of the male genital tract. Okay, all those are the basic anatomy and physiology based questions. Okay, the number of questions from these topics are very highly asked in these last 4 to 5 years. So I strongly recommend you, whether you are studying obstetrics or gynecology, whether it is marrow or any other standard textbook, please make sure that now, that is by the time before the university exam itself, that is in the upcoming months itself, when you take OBGY to study, make sure that you are covering all these chapters in depth, every questions you have to cover, okay, every possible topic, because once that in the last 1 or 2 years they have asked, okay, draw the anatomy of the female external genitalia, label the structures and explain about it. So make sure that you are studying all these basic questions in both obstetrics and gynecology very thoroughly. And of course, when it comes to practical labor, okay, normal labor, abnormal labor, partogram, okay, the stages of labor, the mechanism of labor, with demonstration, you will be given the fetal head and the pelvis, and you must know all those things. And of course, fetal skull and maternal pelvis. Okay, these are the two things you must read in detail. You must know what are the dimensions, what are the parts, all the anteroposterior diameters, transverse diameter, the largest diameter, the smallest diameter, the pelvic inlet, everything, including the numbers and the dimensions. You must be damn thorough, because that is a separate OSCE session which will be conducted afternoon on the day of your practical. And AN diseases, which is the most common cases that you will be getting in your practical exam, GDM, GHTN, molar pregnancy, twin pregnancy. Make sure that you are reading damn thorough, okay, the theory part, and for the practical part you can either refer the textbooks like Hepzibah and some Richu Saxena. Okay, these are the two textbooks which are available for the practical purpose. Okay. So make sure that you focus on the basic questions, because the number of questions has been very high. Please don't do this mistake. Okay. And the other thing what I have to mention is contraception. Okay, contraception family planning is a topic, okay, which the questions has been asked very high. So contraception and the basics, anatomy and physiology, make sure you are reading these 3 topics very thoroughly, because many students ignore it. Okay. And good theory knowledge plus basics in OBGY history taking, the normal examination, that is the first grip, second grip, third grip, fourth grip, everything. What's the normal pattern of history taking in obstetrics, in gynecology. Make sure you are reading the basics, because it's the basic questions that always pose a threat to you on the day of your practical exam. Make sure that you are damn strong in basics, and because the OG examiners will be very irritated if you make blunder mistakes in your practicals. Okay, unlike the surgery and medicine examiners, OG examiners, all of them they are females, and okay, they will expect really a lot, okay, from you. So make sure that you are damn good in basics. Okay, labor partogram and examination of the basic examination history taking obs and gynae. Make sure that you are reading it, so that along with that good theory knowledge either from Marrow or Mudaliar, that will definitely help you to ease your practical exam. And why OG examiners are the most vigilant one? Yes, as I told you, whether you are a boy or a girl, doesn't matter. You must know the basic questions. Okay. And if you make any silly mistakes in the basic questions, they will get irritated, and you have to pay literally a huge price. And the recent years, the increase in failures in OBGY exam. Okay, usually in OBGY, every department gives pass, but in the last 2-3 years, the number of failures in OBGY has been increased. Of course, the reason is because you started ignoring the OBGY subject. Okay, yeah, you just read superficially and go. No, I'm telling, please read OG in depth. So basics, read well. So don't take OG silly. Theory, last 10 years of question papers, all short notes, and make sure all essays, not just the repeated essays in every chapter, every essays, because this is what something I tell in every subject. When it comes to essays, don't compromise. Okay, don't just see the previous year essays, every chapter. And the last 10-year question papers will be enough for all the short note questions. But again, I'm telling, anatomy, physiology, family planning, contraceptions. Practical, Hepzibah, Ritu, Saxena, plus the basics in history taking examination. That will definitely help you to answer the spotters, the OSCE. Make sure you're reading the maternal pelvis and the fetal skull. Okay, all these are the basic things. Okay, if you make any mistakes in the GHT and treatment, okay, the examiner won't get irritated. But at the same time, if you don't say the fetal skull or the maternal pelvis correctly, definitely the examiner get irritated, and they will decide whether you have to get pass or fail. So make sure that you are following these things, and hope this video helps for you while preparing for your OBS and gynae theory as well as practical examination. Thank you.